Thank you all for joining Meet Your Heart Doctor and Your Heart Today webinar. We're really excited to spend the next hour with you sharing lots of great information about heart health. As you're working through and seeing what we're walking through today, just know that we take privacy very seriously. So all of the Q&As just come to the panelists on our side. So just thinking about privacy concerns, if you have questions or anything that you want to ask, just know that it won't be shared with the whole group. We are recording today, and everyone who's attending is on mute. So if you've got any questions, just use that Q&A function. We will have a poll later, so feel free to chime in there. But we're really excited just to jump right in. So maybe we'll start with welcoming everyone, Dr. Paz. Happy Heart Month. It is American Heart Month. We're in February. So we appreciate you the time to celebrate that month and honor Heart Health Awareness Month. I'm your host today, Victoria Andrews, family nurse practitioner by background. I've been at Hello Heart for a little over 3 years and helped support lots of different strategies and outreach and helping bring more heart health tools and programs to you all. So do appreciate your time. And I couldn't be happier to be joined by my colleague, our special guest speaker and cardiologist, Dr. Paz. So I'd welcome for you to introduce yourself, Dr. Paz, to everybody.
Thanks so much, Vic, and thank you to everyone who's joining the webinar today. We're so happy you took some time to be with us. My name is Ido Peled. As Vic mentioned, I'm a cardiologist. I did my medical training in internal medicine and cardiology at New York Presbyterian Hospital in New York City. I joined Hello Heart about 2 years ago to be the Senior Vice President of Medical Affairs. And I also still practice cardiology part-time at White Plains Hospital, which is a regional hospital here in Westchester where I live. And we're going to have a lot of great discussions today about the importance of heart health, why blood pressure matters, why cholesterol matters, steps people can take to improve their heart health. And let's dive right in.
I love that so much. So we're going to focus a few different areas, few different topics for today. We'll start off by talking about why heart health matters, especially thinking about American Heart Month right now and how you can show your heart some love. We'll also talk about the Hello Heart program and how when you take care of your heart, some amazing things can happen. And finally, should you have questions, as I already mentioned during the webinar, you can use the Q&A button located on your Zoom menu. All questions will be private, and we'll get to as many of them as we can during our call today. Your engagement and questions also really help us inform additional topics and webinars that we can offer in the future. So keep that feedback coming. We love it here at Hello Heart, and it does really shape what we can share out to you all and provide back for great education. So we've got a lot to share, but let's start with a little game of 2 truths and a lie. So 2 of these statements are true, and 1 of them is not so true. So let's start, and we'll just kind of think through these in your head, and we'll see which one is the correct one. So the first one is your heart beats around 100,000 times a day. 100,000. So let that number sink in. There are between 5,500 and 12,000 miles of blood vessels in your body. That would take us a long way. So just think about all of those vessels within your body. And then finally, the third option is your heart pumps 1,000 gallons of blood a day. 1,000 gallons of milk. Let's just think about that for a second and how much blood could be pumping through your body. So again, 2 of them are true and 1 of them is not so true. So as you're thinking about it, have that number 1, 2, or 3 in your head. We'll see here what the answer is. Dr. Paz, you probably know, so I'm not even going to ask you and put you on the spot. So the answer is your heart does not pump 1,000 gallons of blood in a day. It's actually closer to 2,000 gallons of blood a day, or 32,000 cups. So just know that the heart does amazing things. When you start to put numbers in these kind of impact and amount of work that it does in a day, it's hugely significant. So I just want to take a moment for the heart. Dr. Paz, what can you tell us a little bit more about it? I mean, we heard some things on why it's incredible, but why is it so incredible?
Yeah, so the stats you just gave, I think, are really stunning. The most stunning part about what you just presented is that happens every single day of your life. The heart is easily the hardest working muscle in the body. Just to give a sense of the numbers we were talking about, thousands of gallons of blood every day, beating 100,000 times a day through thousands and thousands of miles. So there's a ton of brute strength. But the thing which I'll mention about the heart is that it's not just brute strength. It's really a well choreographed and beautiful symphony. Even on this schematic, this cartoon that you see here on the picture, you see that there are 4 chambers of the heart. There are 4 valves in the heart. We see 3 of them here, but there's a 4th valve. The job of the valve is to make sure that the blood flows only in the forward direction, doesn't flow in the backwards direction. Of course, all of this needs to be coordinated. So there's a complex electrical system which guides the heart to beat. And then just like any organ, any muscle, the heart itself needs a blood supply. It doesn't get blood from the blood that's inside of the heart chamber. There's actually blood vessels that feed the heart muscle itself. So it's a beautiful organ. It's always working, and it's really actually quite complex if you take some time to think about it.
Definitely. I love this cartoon because it makes it kind of bring it to life a little bit. We know it's a lot more complicated than that, but there's some really great kind of just emphasis here on how much has to be in sync, right, for it to work effectively. And I think that's why we're here at Hello Heart, right? We're on a mission to help everyone understand their heart and understand their heart health, and then to appreciate it. And then maybe even more importantly, understand how important it is to take care of it, especially when we think about longevity and the opportunity of all the great things that we get to do throughout our life. All right, so let's get into the good stuff. Before we talk about how to take care of the heart, let's talk about why it's so important to have these conversations. So I'd love to know a little bit more about, why should we be thinking about heart health? Why does it matter?
Sounds great, Vic. So, I may be a little bit biased because I'm a cardiologist, but I would say that by most measures, heart health and heart disease are the most important health problem affecting Americans, even thinking about it worldwide. It's the number one in prevalence. That means the number of people who have the disease, and it's also the number one cause of death. Those have both been true for quite a long time. It's been the number one cause of death for decades and decades. On the left side of the slide, you see a couple of numbers that just support that. More than half of adults have high blood pressure or high cholesterol or both. Even if you just think about high blood pressure, almost half of adults, 48%, have high blood pressure. That's 120 million people. If you think about kind of the burden of people dying from cardiovascular disease, it's very significant. Every 33 seconds, someone is dying from cardiovascular diseases, and that translates to more than 700,000 deaths per year just from heart disease. And I think part of this relates to the fact that, the 2 most important risk factors, the most common risk factors for heart disease, high blood pressure and high cholesterol, are considered silent conditions, meaning there's 120 million people with high blood pressure, but the vast majority of them don't feel any symptoms related to high blood pressure. So if you don't get checked, if you're not aware of it, you can live your life with this problem. And even though you may not feel differently, it's causing issues in the background to your heart and to the other parts of your body as well.
It's really incredible how many folks are actually struggling with this, whether they know it or not. The thing that stands out to me that we've talked about over the last few years is that we've now kind of gone over that 700,000 mark when we look at deaths caused by heart disease per year. For a long time, we were underneath that 700,000 and in a lower percentage, but those numbers keep rising, which, tells us we're not necessarily moving in the right direction.
That's right, Vic.
So we're going to use our imagination just for a moment and think back to maybe when you were kids and you played the operation game. That's what comes to mind here when I see this slide. So I think it is helpful, Dr. Paz, if you could spend a moment just talking about how the heart really is connected to everything else across our entire body.
Yeah, so the numbers we just discussed on the prior slide, if anything, they're an underestimate of the burden of heart-related issues. That's because the same problems that can develop in the heart, for example, the buildup of plaque, the buildup of cholesterol on the inside of blood vessels, if it happens in the heart, that can be a heart attack. If it happens in the brain, that same process, that could be a stroke. But even beyond those, I think people understand that heart attack and stroke are related. Risk factors for heart disease have been implicated in a lot of other issues. For example, dementia, memory loss, vision loss, Kidney disease is one of the most common problems that people with heart disease, high blood pressure develop kidney disease. There's a lot of overlap there. And you can see on the screen here, really just about every key organ system is related to the heart, related to heart risk factors, and all of our organs rely on the heart to provide it the blood supply that they need to function normally.
Yeah, I mean, if we think about all of those vessels that we talked about in that stat earlier, how many miles of vessels we have within our body, that's going everywhere. All of those critical components of our body that need that blood, to your point, to work effectively, that heart has to be able to pump it, and those vessels have to be able to deliver it. So it definitely is very systemic and across the whole body. So I think another big reason to talk about heart health and why it matters is because there are a lot of gaps when we think about heart health. We think about risk, when we think about social determinants of health and within our communities. One thing that many people don't know is that heart disease is the #1 cause of death for women and for men. So both of those, both groups see that as the #1 slot. And we also know that women are twice as likely as men to die after a heart attack. So those mortality stats are not good when we think about the women in our lives that we care for. Heart disease is also the #1 cause of death for Black Americans, who are more than twice as likely to die from cardiovascular disease than their white American counterparts. And as we think about Hispanic adults, Latina Americans, they're definitely at significantly higher risk for heart failure than white Americans. So as you think about which community you belong in, or which types of factors impact you, and kind of your own personal experience, it's important, I think even more important than ever, to take heart health into consideration and help empower folks and bring awareness to the potential additional risks that folks have. And I know it cannot be the most uplifting thing to talk about cardiac events, but I would think that knowing your risk is half the battle.
Yeah, I think the most important stat, if there's one stat that everyone should remember, is that 80% of heart disease, by some estimates, 80% of heart disease cases would have been preventable if we did a better job of managing the risk factors of heart disease, like high blood pressure and high cholesterol. So all of the slides all of the data points that we just went over, in terms of the number of people who have it, the different populations who are impacted by it, for the 5 people on the screen here, 5 people on the screen who are going to have a cardiac event, 4 of them could have been prevented if we did a better job of managing the risk factors. So I think there's a tremendous opportunity here. I think sometimes people have a feeling that heart disease is inevitable, and that's definitely not the truth. There's a lot of opportunity here to get yourself checked, to identify these problems. And if you identify problems like high blood pressure and high cholesterol, fortunately, we actually understand very well how to treat those things. There's medications, there's diet, there's exercise, there's lifestyle. We're going to get into some of those in just a few moments, but there's really a lot that could be done, which is why we think awareness here is so, so important.
Dr. Paz, you mind spending just a moment on those things that aren't preventable, just to kind of show kind of the difference? We'll spend a lot of time in the next few minutes talking about the preventable side, but maybe if you could just help people level set on, what's not the preventable, that 20% that, has less influence there.
Yeah, so when we think about heart disease, we think about the risk factors for heart disease, and we consider them as either modifiable or not modifiable. Obviously, modifiable things are things you can change. You can lower your blood pressure, you can lower your cholesterol, you can quit smoking, you can change your diet, you can change your exercise. There is certain risk factors that we can't change. You can't change how old you are. You can't change your genetics. You can't change whether you're a man or a woman. But for the vast majority of the risk factors, we really can impact the risk, and that's where we're going to choose to focus, I think, in the next part of our talk here.
Thank you. That's helpful just to understand the differences there. All right, so I think that's a really spot on thing, that there's so much that we can do. There's opportunities that exist for us to kind of think about prevention, focus on those areas. So I think we'll dig into now a little bit more on the habits that can impact your heart health, and then how you can start to incorporate healthy habits into your daily life. So what are some things that we all can try to start to add to our plans, and try to improve our heart health there? But first, let's pause again. I want to hear from the audience. And this time it's actually a poll. So you should have a poll that popped up right in front of you. And this is really just looking at, on a scale of 1 to 5, how important is heart health to you? So maybe it's a 1. Maybe you've got other things going on where it's not as important. Or maybe it's all the way out of 5 and extremely important. So in this case, you can just click on which how you feel and where that falls for you. Dr. Paz, I might put you on the spot, and I think I know the answer to this, but how would you rate it for yourself?
Now, I think you would expect it to be a 5 for me, but if I'm really being honest with myself, how often am I thinking about my own heart health kind of explicitly? If I'm being honest, it's probably around a 3. And I think that there's always opportunities. This is the challenge. There are things that we do every single day that impact your heart health. The things you eat, the way you activity, exercise. These are things that every single day we can make choices, and it's hard to make the right choices over and over again, especially when you've got other things that you're worried about. So if I'm being honest, it's probably a 3 for me, even though I wish it was a 5.
Yeah, I think that's not uncommon, right? Even though you're talking about it daily,
Yeah.
and then in your practice too. So the poll results are up, so you should be able to see them there. 75% of you all said 5. It's extremely important, which I think is a testament to you all carving out an hour today to talk about heart health. And then I would say, from there it kind of narrows down. So kudos to you all for making it important, and kind of continuing on this journey of learning more about what you can do with your heart health. So thank you guys for playing along with our piece there. Digging into that a little bit more, we are going to share some tips through the lens of the American Heart Association. So I'm sure many of you are familiar with them. What they put out was something called Life's Essential 8. It's a tool that defines 8 key measures for improving and maintaining cardiovascular health. This has actually evolved from some previous iterations, and they've actually added some more, what I would say, components into these essential 8 things that we need to kind of continue to consider. And I would say we oftentimes get overwhelmed by, oh my gosh, I have so many of these things and I got to do so much to make an improvement. But really, you can start small and not try to bite off too much. You don't have to get overwhelmed. You can start with small little changes. So think of that as we go into these next few pieces and discussion points, that these are building blocks to your larger goals. So if you've got a big goal, if I want to, do XYZ thing with my family later this year and my heart health is important there, just know that there are small building blocks that you can start to build off of. It's almost like a snowball effect over time, that once you start getting some of those positive reinforcements, kind of makes it towards your bigger win over time. So let's dig in here into what American Heart Association has to say. So first up is improved nutrition. They call it eating better. And I'm sure you could have all guessed that this tip would probably have made the list, maybe even being number 1. And if I'm honest, I'm not great at getting in the 4 to 5 servings of fruits and vegetables per day. It's just, I'm busy. I don't think about it. So would love any insight that you wanted to share, Dr. Paz, around maybe a tip for our listeners and our attendees today.
Yeah, Vic, I really like how you mentioned that you don't need to do everything all at once, right? You're not going to go from doing no exercise to running a marathon tomorrow. That's not realistic. So it's great to pick small and achievable goals, achieve them, build on that success, and then kind of keep going. Develop some really nice and sustainable habits. So what my hack here is, my tip is that try to camouflage veggies and sneak them in ways that you might not think about otherwise. This is something that I can relate to because I have young kids. So I'm always thinking about how to sneak veggies in. So for example, if we're making banana bread, you can sneak some zucchini in there. If you're making turkey meatballs, you can add a vegetable, mushrooms or spinach, to add some extra flavor and some extra nutrients. I always like to focus on things you can incorporate into your diet, even bit by bit.
I love that. And I don't know if you've used this on their site, but they actually offer lots of great recipes. And so if you're looking just for ideas that are, focused on heart health in particular, they've got some great kind of considerations and things. They also do a great job of lower sodium. So while we're not necessarily focused on that for this piece here, they've got some really great ways to keep sodium low if you're managing and watching that portion for your kind of nutrition choices. All right. Second, and probably my favorite, is to be more active. So, probably not a surprise here. We hear this all the time. Exercise is important, being active is important. But again, lots of it's time consuming. Maybe you're busy. It can feel like work. Not everyone enjoys it. How do we help folks think about this more like a play type experience than just a a workout? So curious your thoughts here on like what's a tip for being more active?
Yeah, and I think you're exactly right, Vic. My tip here is to find an activity that you enjoy doing, and it'll be easier to do it. So if you like running, if you like jogging, great, go run and jog. But if you don't like running and jogging, there's lots of other ways to be active. You can walk, you can swim, you can play tennis, you can dance, you can play another sport, you can take your dogs on nice long walks. There's lots of ways to be active. They're all meaningful. One of the things that we know from the evidence is that, activity is meaningful even if it's in small amounts. Getting up and doing a 10-minute walk around your neighborhood, it's meaningful. You don't need to do just 2.5 hours in one sitting. That's not realistic. So find an activity that you like and then just start doing it. No activity is wrong. Anything that you enjoy doing is a great activity for you to be focused on.
I love that. I've seen the American Heart Association talk about these snack kind of ways to exercise. And I love that image of just having an exercise snack. So that 10-minute little burst through the day that you can do adds up. So instead of, to your point, if you don't have all of that time, those exercise snacks can be a really great way. I would imagine there's also some considerations if folks are managing high blood pressure or other cardiovascular concerns that it'd be important to talk to their provider if they have any questions about what's appropriate for them.
Absolutely, that's true.
Okay. So number three is quit tobacco would be as part of their kind of life's essential eight. This one is very, very important, but is very, very difficult for people who are using tobacco on a regular basis. So Dr. Poswell, we definitely understand that this is not the easiest thing to do. Do you have some ideas or tips on quitting tobacco for folks?
Yeah, so for those patients of mine who smoke, I tell them two things. Number one, quitting smoking is the most important thing that you can do for your health. Nothing else is more important when it comes not just to heart health, lots of other health problems. You would be better off if you weren't smoking. The other thing I tell people who smoke is that quitting smoking will also be one of the hardest things that you're going to do. So what my tip here is really to develop a plan, get ahead of it, and ask for help. So, pick a date that you want to do it, decide, are you going to do it cold turkey? Are you going to phase it out? Are you going to ask your provider for help? I think, your prescribing provider, whether it's a doctor or another provider, there's nicotine replacement, there's prescription medications that help for cravings, ask them for help. And then another fun thing is to maybe pick another habit that you can do instead. So when that craving for a cigarette helps, maybe it's doing Legos, maybe it's going for a walk. Pick a different habit that can kind of fill that space in your life so that you're not, those cravings are a little bit easier to deal with.
Yeah, I would say asking for help is the best thing that you can do, not trying to do it on your own. And then I would also just expand that even out more. So while cigarettes are what we commonly think of when it comes to quitting tobacco, any of the other kinds of things like e-cigarettes, vaping, anything with the nicotine component in it is actually increasing your risk when you're thinking about heart risk over time. So it goes beyond just traditional cigarettes here. You want to think about all potential pathways that folks might be using tobacco. All right, number four. I said exercise was my favorite, but I think getting healthy sleep is probably right up there at the top, especially Dr. Paz, you and I both have kids, so getting good sleep is not always a given. And it's important to all of us in different ways. And I think we've learned, especially in the last number of years, how big of an impact it can have on overall health and well-being and how we're doing. So as we think about healthy sleep and what that actually means for folks and how they translate that into their day-to-day, do you have any ideas how we can support heart health through better sleep?
Yeah, and sleep really is so important. Sleep was actually the most recent addition to Life's Essential Eight. When you said we went from 7 to 8, sleep was the new kid on the block. When it comes to sleep, what my tip is really to think about a good plan for your phone. I think many adults with smartphones will end up on their phone at night. And not only does doing that activity keep you from sleeping, but there are bright lights in your phone, which might make your body harder to kind of transition into that sleeping phase. So most of my tips had to do with your phone. Ideally, get your phone out of there, put it in another room, charge it in another room. I know that for most of us, that seems a little stressful, but there's other things you can do. There's do not disturb function so that, if you get a text message or an email in the middle of the night, you won't get a notification. There's also settings where you can actually, just like you can set an alarm to wake up in the morning, you can set an alarm like a nighttime alarm that the phone will alert you it's time. And then lastly, most smartphones have settings for kind of night mode, which switches the type of light that's used on the phone to a light that's less bright, and kind of allows your body to, slow into that transition into sleep as opposed to kind of being awake and stimulated, and then you put your phone down and you can't really sleep even after you've put it down.
Yeah, those phones, they have lots of great benefits, right? We leverage them here at Hello Heart for sure, but there definitely is a time where we need to put them down and focus on some of those habits around sleep. So I think those are great tips, and definitely going to take the dimming one, kind of start to decrease that as you go through the evening time. So I love that tip. All right, we've heard a lot. If you're watching the news or if you're reading any articles or seeing what maybe news is on your phone, there's a lot of conversation around managing weight. Various things have come onto the market to be able to help support that. And so this is a pretty broad topic, right? When we talk about managing weight, there's a lot of factors that go into this. But I'm curious your thoughts on any tools that people can help if they're thinking managing weight is one of those things that they want to kind of focus on over the next few months for themselves.
Yeah, weight is an important topic for many people because aside from its impact on health, there's also other kind of feelings that people have about their weight. What my tip here is focus on what you want to incorporate into your diet as opposed to what you want to cut out. What I think this accomplishes is that, we at Hello Heart, one of our philosophies is it's always good to be positive, to reinforce, to build on victories. You tend to have less success if you're punishing yourself for doing something wrong. It's always better to focus on the positive, which is why here, rather than, punish ourselves for not achieving a goal or, not doing some activity like calorie counting, focus on what you want to incorporate into your diet as opposed to what you want to remove. And I think, again, when you achieve small successes, you can then build on those and they really more become ingrained in your habits because, there are no quick fixes here. This is a day by day, creating sustainable habits. And I think that's what I say about weight.
Definitely. And it is more complex for many folks than just calories in and calories out. So just recognize that if this is an area that you're struggling with, talk with your provider, talk with your care team. You can find other solutions in terms of the small little victories that you can have in setting small goals through this. So it doesn't feel as overwhelming and you can kind of figure out what's unique to you and what works best for you. All right, we're on to number 6. And again, probably one that's near and dear to your heart that you talk about every Thursday in your clinic, but is controlling cholesterol. So maybe you can just tell us a little bit about what cholesterol is and then maybe a tip that you have around that.
Yeah, so cholesterol, most people think it's all bad. It's not true. We need cholesterol to live. It's a key part of our body. Cholesterol comes from two sources. It comes from the things we eat, but your body also makes cholesterol. That's how important it is. Cholesterol is it can seem complicated because there's different types. There's total cholesterol, there's LDL cholesterol, there's HDL. The two I'll focus on are kind of LDL, which is the bad cholesterol, because elevated LDL increases your risk of having a heart attack or a stroke. But there's also HDL, which is there's a movement to go away from calling it good cholesterol, but there are some protective benefits to that. I think my tips here are number one, to get screened and to get checked. You don't know if this is an issue without getting checked. As I mentioned with high blood pressure, people with high cholesterol don't necessarily have any symptoms. So the only way to know is to get checked. If it turns out that you do have high cholesterol, there's a lot of dietary changes you can do, exercise changes, which would help. And, reading nutrition labels can be tough. So what we want to focus on is replacing saturated fats with unsaturated fats. That's one way to really focus on the ones that are more healthful, more beneficial, and cut out the ones that have less of a benefit and cause more of a problem.
That's super helpful. I know we had lots of questions around cholesterol and some of the newer things that are out there around LP little a, for example. We also get lots of questions around calcium channel scoring, like CT type things. So anything that you want to add about some of those newer things or kind of pathways through their cardiologist that they might want to ask about?
Yeah, absolutely. So as I kind of implied earlier, one of the first steps is to understanding your own personal risk, and a lot of things contribute to that risk. Some of the things I mentioned earlier, especially blood pressure, cholesterol. So, getting checked. The first test I do with all my patients is a basic lipid profile, which shows, total cholesterol, LDL, HDL, triglycerides. Now, in most cases, after we've done that test, we can put a plan together. In some cases, though, we need a bit more data. So let's say, for example, you have a really strong family history and your numbers, your risk might be higher than we get the sense of from your cholesterol testing. There are other tests that can kind of refine our risk assessment. LP little a is a more advanced blood marker that some doctors are using to create a more personalized risk. Coronary calcium score, it's actually a low-dose CT scan, a CAT scan, the same kind of imaging technology as in X-rays or in CAT scans of your lungs. We do a low-dose CAT scan of your heart to see if there's any buildup of calcium in the heart arteries. Those really allow us to get a highly personalized assessment of your risk that can really then create a very tailored and personalized, plan just for you.
That's super helpful. I think people having some awareness around what are some other things they could talk to their care team about, and have an understanding that there's a baseline and then potential things that they may want to talk with their care team about. So I appreciate that. That's helpful.
That's exactly right, Vic.
All right, number 7, essential tip here is to manage blood sugar. And so when we think about blood sugar, we often think of diabetes, or we think about pre-diabetes, or even kind of at risk for diabetes, or maybe different various things when people think about managing blood sugar. So maybe we just want to spend a moment here and tell us a little bit more about why it's included in this essential aid and why it's important.
Yeah, so just to spend 1 or 2 minutes on the science, I won't get into this in too much detail, but when we eat food, our body breaks it down. Carbohydrates get broken down into sugars, like glucose, which then enter the bloodstream. Once glucose is in the bloodstream, your body secretes a hormone called insulin, which helps get the glucose out of the bloodstream and into the body's, where it belongs within the body. What diabetes is that there's really two kind of main drivers of diabetes. Some people just don't make insulin. That's type 1 diabetes. That's a problem that really the solution is you have to take insulin externally. Or the other kind is type 2 diabetes, the much more common type of diabetes, is that over time, your body becomes less sensitive to insulin. The amount of glucose that you're consuming is too much for your insulin to handle. In both cases, if the level of glucose, if the level of sugar inside the blood is too high, it can damage the different organs of our bodies. The eyes, the heart, the kidney, the nerves, all of these can be damaged over time. And that's why we really worry about diabetes. Heart disease is one of the main, it's the most important kind of driver of bad outcomes for people with diabetes. People with diabetes, the number one killer of people with diabetes, just like for most others, is heart disease. So we really think a lot about having good control of your blood sugar, if you have diabetes, trying to focus on having it be very well controlled. Now, for people who don't have diabetes or people who maybe have pre-diabetes, there's a lot that can be done in terms of diet and exercise habits. So as always, I like to focus on things to incorporate as opposed to things to remove. So, whole grains are better than kind of white grains, and dietary fiber. These are great hacks that can help control your blood sugar. They're also good for your cholesterol as well. They can raise your good cholesterol. They can lower your bad cholesterol. They help keep you full. They help keep your bowel movements regular. There's a lot of good reasons to have high amounts of whole grains and dietary fiber, and blood sugar is just one of those issues that can be helped here.
That's great. I appreciate you kind of walking us through why it's important. And again, I think this is something that as you're talking to your provider or your care team, talking about your risks for maybe increased blood sugar or some of these concerns, it's another simple testing that your care team can do for you, and you can start to understand your risk even better through there. All right. The last of the essential eights is managing blood pressure, which we here at Hello Heart, we spend a lot of time thinking about. And I know you spend a lot of time consulting your patients on, talking with various folks about blood pressure. So would love to hear a little bit about your thoughts around how folks can manage their blood pressure consistently.
Yeah, as we said earlier, blood pressure is the most common risk factor for heart disease. There's 120 million Americans with high blood pressure. Unfortunately, the vast majority of those don't have it under good control. Now, my tip here is to start simple. You got to start by knowing your risk. You got to start by knowing your numbers, because as I said earlier, people with high blood pressure don't necessarily have symptoms related to it. The vast majority of people with high blood pressure don't feel differently because of it. So you have to know your numbers. That could include getting screened at your doctor's office. Even better is to track your blood pressure at home so that you can really be aware of it. And also, especially for people who are now being treated for high blood pressure, either with diet and exercise habits or with medications, tracking your blood pressure at home is a great way to know how well you're doing. It's not, you don't need to do it once a year at the doctor's office. You can do it at home. You can keep track of it. You can look for patterns. And I think, knowledge and understanding of your risk is the first step of kind of taking control of those risk factors.
I love that. And my husband will probably kill me for sharing the story, but he was tracking his blood pressure, and what he saw was the influence of if he had alcohol the night before and then onto his blood pressures the next day. And that was enough for him to say, oh, there's this kind of impact that I'm seeing regularly that he didn't like in terms of his outcomes and what he was seeing there. And that actually shifted his behavior to say, okay, that's not working for me. Let me do that. But he wouldn't have known that had he not been tracking to kind of see what those trends were over time. So don't tell him I told you, but that was just his own personal experience of what he saw with, alcohol's effect over time.
Yeah, the first step is knowledge. You have to know about the problem before you can kind of come up with a plan to address it.
Definitely. So we went through a lot of great information fairly quickly. Again, the American Heart Association site has tons of deeper dives into any one of those areas. But I just would love for our attendees today, and even ourselves, Dr. Paz, to think through, what are some ways, what's a simple thing that I want to do to show love to my heart? So take a quick moment here. We'll give people just a second, either pull out your phone, maybe you've got a piece of paper nearby, you want to jot down a note to yourself, and ask yourself, what is one thing that I can do to take care of my heart today? Maybe that's get to bed at a certain time, or maybe that's I'm going to incorporate a new vegetable each day, and then post that somewhere for you to think through as a reminder of making heart health a priority for you, especially as we finish out this American Heart Month in February. So I'll give y'all a moment just to kind of write that down and have a thought about it. Mine's going to be the vegetable. That's where I'm headed. Add another vegetable in. So I'm going to sneak that in, like you mentioned, Dr. Paz.
My favorite is some nice deep breathing relaxation techniques, because we're all always so busy running around doing the next thing that taking a moment to take a deep breath, slow down, be present in the moment. That's what I'm always trying to work on, and that'll be my tip for the day.
I like it. All right, I'm going to ask you about it later, where it's posted on your computer.
Sounds good.
All right, we got a fun little section next. We're going to play some games, and think through fact or fiction. So what we'll do is we'll have a statement come up on the screen related to some common thoughts around things that might be impacting heart health. And then you can answer fact or fiction. This isn't going to pop up with a poll this time. It's just kind of for your own thoughts as you're looking at these as we come up. And then Dr. Paz will provide some context about it. Okay. So let's get started if you're ready. So first, this one might seem a little strange, but I've heard that laughing yoga or laugh therapy. So let's see if this is fact or fiction. Laughing can influence your heart health. Fact or fiction? So y'all think about it.
I see some answers in the chat too.
Oh, great. So it's actually,
And everyone who's answered has been right. It is a fact. So, laughing, whether it's at a movie or with your friends, it is good for your heart. There's a lot of different processes that are happening in our body, and laughing can help with those. So, for example, stress hormones, those are bad actors. A stress hormone when you're a prehistoric human being chased by a tiger, yes, it's good that your heart rate goes faster, your blood pressure goes higher, you start breathing faster. Stress is a bad actor over time, and it can increase your heart risk. Laughing can reduce some of those stress hormones. There's also a process called inflammation, which is basically when your body's blood markers are reacting to some stimulus and mounting a response. Inflammation, it's good if you're sick, if you have a cut, but over time, chronic inflammation is a bad actor. Laughing can also help with that. There's even been some evidence that laughing could be beneficial for some of our cholesterol markers. So yes, it's good to laugh, it's good to be happy, and that's a fact.
that's pretty good. I'm going to go watch a funny movie later and try it out. All right, so the next one is fact or fiction. Taking care of my teeth has nothing to do with heart health. So what do you all think? Is that fact or fiction? Has nothing to do with my heart health.
Yep, and most of the responses I'm seeing in the chat are right. That's false. Uh, Flossing does have to do with heart health. Now, it used to be felt that maybe this was more of a correlation. People who are likely to take good care of their gums, maybe they just have other good habits. They're more likely to take care of their body otherwise. Maybe they're less likely to smoke or drink alcohol. But even when accounting for those, it does seem that dental health is an important predictor when it comes to heart disease, even after you account for all those lifestyle habits that might be correlated with dental health, gum disease, et cetera. That's because when your gums have bacteria and inflammation, again, those are things that can get into the blood and impact other parts of the body. So having diseases of the gums, it's actually associated with an increased risk of having heart disease. So taking good care of your teeth, brushing, flossing, mouthwash, whatever your routine is, taking care of your teeth and gums is important. It's beneficial, even for your heart.
Great. I'm going to tell my kids that too. Make them floss more regularly. This is also one of my favorites. So dark chocolate is good for your heart. Fact or fiction? I think I know. I think we've seen enough of this maybe in the media, but curious there, the thoughts on it. Fact or fiction?
And again, everyone is right here. Dark chocolate, there has been some evidence that it is beneficial for the heart. There are some substances inside of dark chocolate called flavonoids, which can help relax our blood vessels, and can even have some benefits in terms of antioxidation or improving our cholesterol. But what I would say here is a few things. Number one, you really want to focus on dark chocolate with a high level of dark chocolate, 70% or more. To take dark chocolate and turn it into milk chocolate, they add a lot of sugar and other things that don't have much nutritional value. The other thing, of course, is you do have to do this in moderation. So I think, 1 or 2 squares after dinner is a great treat that you can indulge and enjoy, because there are even some long-term studies of this that have looked at people who take cacao, the active ingredient in dark chocolate, and it is, there is some evidence that it's beneficial and protective in the long term. So this is a fun one. Hopefully it'll make people happy that you can have a couple of squares of dark chocolate after dinner.
Yes. And I heard that keyword moderation for all of us on most things in life. All right. I mentioned alcohol earlier, so I think it's kind of fitting here with this particular question. And I know there's been lots of back and forth on this particular topic. So red wine is good for my heart. Fact or fiction? I think most people want you to say fact. So I'll just say that for all my wine lovers out there. So I'm sure there's lots of thoughts on this one, but it's actually
Yeah, so this is a great question, and I'm looking at the chat here, and it's been about 50-50 fact and fiction. And I think that actually corresponds to the way we've told the red wine story. You know, there used to be some evidence that red wine was protective. There are these substances in red wine called polyphenols, which are antioxidants, and it was felt that maybe these could help protect the lining of blood vessels. However, more recently, the more we've studied alcohol, we've learned that really any alcohol in any amount is probably harmful for you. It can lead to kind of maybe other, worse habits when it comes to diet, exercise, and lifestyle. And overall, the literature here really is mixed. So I wouldn't say that red wine is good for your heart. What I would say though is, the position of the American Heart Association is that you shouldn't drink red wine because you think it's going to be good for your heart. But if you are going to drink alcohol, red wine is a good choice as long as we do everything in moderation, which is, for a man, it's 1 to 2 drinks per sitting, and for a woman, it's about 1 drink per sitting. So everything in moderation. We can do things that are not necessarily good for our health if they create enjoyment or other benefits. But I wouldn't say that red wine is good for your health. You shouldn't start drinking red wine because you think it's going to help you lower your risk of having heart disease.
That's helpful. The other thing I always encourage folks to do is actually look at what the serving size is. Some of us have a heavy hand when it comes to pour, and so you may actually be having 2 servings in one glass. So just make sure you're checking yourself on some of those serving sizes that you might be choosing. All right, last question. And this one I think hits home for so many of us who are attending this today. I know there are a lot of people out there who think it's too late to try and change, so why do anything now? So I'm curious here, fact or fiction, I can't reverse the damage done to my heart. Hopefully, we said that earlier. There's some good things that can be done, but fact or fiction for everybody. I know people are writing in the chat here, so I have a feeling they'll know the answer to this, but it's actually fiction.
Of course. And I saw someone's message came up that said never too late. And I love that message. It really is never too late. I mean, a couple of examples I'll give are, smoking. We spoke about smoking earlier, and I said it's the most important. If you smoke, the most important thing you can do for your health is quit. And that's because when you quit, within a year, your risk of heart attack goes down by half. I also think about my patients who have had a heart attack and their heart muscle is weakened after that heart attack. Those are the people that we focus the most on because there's a lot that they can regain. They can lower their risk significantly of having another event. You can even take a heart muscle that's been weakened by a heart attack. If we get on the right meds, we get our blood pressure under control, we fix the underlying problem that caused the heart attack in the first place, that heart muscle can recover back to the normal pumping that it had before. So it's never too late. I hope that's one of the key takeaways of our webinar today, that there's a lot, heart disease is preventable. Knowledge is power. So you can always reverse damage. It's never too late to try to reverse the damage that you've done to your heart.
That's great. And I think that goes right into what we wanted to kind of close up here. We'll get into some time for some Q&A in just a minute, but as many of you already know, Hello Heart, we're nearing the end of the presentation, but we wanted to share just a few things about how Hello Heart can support you on that journey. I think to your point earlier, Dr. Paz, the knowledge is power, and I think that our program can really help folks have that knowledge and awareness. So even when you may be checking at home, you're not always sure what to do with those numbers, that's where our program can really come in and make a difference. So most of you have the monitor and app already, and if you don't worry, we're going to talk on seeing if you're eligible and how you can easily enroll in our program. We've also got some great new functionality and capabilities in there if you haven't been in there recently. So you can track your blood pressures at home, making it really easy to monitor your progress, like I showed that example earlier, and then share that out out with your care team. You can track other key metrics right alongside that, medications as well. So helping you stay on track with medications that have been prescribed to you. Keeping up with those sometimes can be hard when we're so busy. So our app makes it really easy for you to do that. Detecting irregularities, and then receiving personalized insights and digital coaching. So we've got new functionality for women who might be transitioning and going through menopause that can support you on that. We've got new capabilities to support women who may become pregnant while managing their blood pressure concerns. So lots of great things in there and highly personalized to you as the user. And then ultimately that starts help building awareness around heart health and help empowering you to have more informed conversations with your care team and those who you're working with. So if you're not already enrolled in the program, it's super easy to sign up and you might be eligible for Hello Heart. We will be following up with an email for those who aren't registered in the program. Maybe you heard about it from a coworker and joined our webinar today. There are some eligibility criteria depending on who you're working with in the organization, as well as then instructions on how to register. And if you aren't enrolled if you are enrolled but haven't used Hello Heart in a while, you're not sure how to log in or access Hello Heart icon like you're seeing here on the screen, and you can get that into the App Store and get right back onto tracking. Sometimes these good reminders here of there's so much, things that you can do from a prevention standpoint get you motivated again. So, dive right back into the app and start using it to help support that journey for you. We've also got a support team. If you've got questions or need to do some outreach, you can see that here on the screen. All right, we had lots of great questions come in prior to the webinar. We've had lots of great ones coming in through the Q&A today. So in the last few minutes of our conversation or discussion today, Dr. Paz, I'm going to just throw some of the questions out. We won't be able to get to all of them. Sorry, everybody, but we'll try to get to as many across these different genres of things that we've had. So I do know there was a question around women's heart health in particular. And why do you think it is, or why is it that women die 2 times higher, that mortality is higher for women following a heart attack? That was one of the questions that came in. So we just want to expand on that a little bit, on the whys behind that.
Yeah, so Vic is referring to studies that shown that a woman having a heart attack may have up to twice the mortality of a man having a heart attack. And what we've seen in kind of study after study is that most of this is due to the fact that we do a poor job of recognizing, diagnosing, and treating women with heart attack. They've looked at studies, and pretty much every step of the way, when a woman is having heart attack symptoms, it takes longer for that ambulance to be called. When that woman ends up in the emergency room, it takes longer for her to be evaluated by a physician and to get an EKG. When it comes time to get the best procedure for someone having a heart attack, which is an angiogram or a left heart catheterization, women are less likely to get that procedure. Women are less likely to leave the hospital on the right medications. They're less likely to get cardiac rehab. Pretty much every step of the way of, the way you want a heart attack to be treated in the perfect way, women in study after study, it's been shown that they have not gotten the best treatment. And that's one of the main drivers of worse outcomes for women after a heart attack as compared to men.
That's helpful. I think one of the other questions that we had in here was around, why females might be getting different care than their male counterparts. I think that's why we exist at Hello Heart, is to bring awareness so you can start asking questions and start advocating for yourself, knowing that sometimes even the provider's best intent may not manifest into the best care. So being able to advocate for yourself, I think it is a really key piece in there. On those same lines around menopause, we typically see questions around hormone replacement therapy. I know there's been lots of different recommendations over the years, so just curious about that.
Yeah, so first, again, a bit about the science. So estrogen is a hormone in women, and it turns out that estrogen is protective. It's one of the main reasons why before menopause, the risk of cardiovascular disease is much lower in women as compared to men. However, around the time of menopause, estrogen kind of levels, they drop significantly. And at that time, cardiovascular risk in women goes up. Blood pressure goes up, cholesterol might change, the risk of having a cardiac event goes up. When it comes to hormone replacement therapy, there have been a couple of studies in the past which I think showed that there were some risks associated with hormone replacement therapy. But more recently, we've learned that in the right woman, if we pick women with the right characteristics to receive hormone replacement therapy, not only is hormone replacement therapy one of the best treatments for symptoms of menopause, like hot flashes, but it actually can be protective and it can lower risk of all-cause death from any reason. So hormone replacement therapy is definitely a viable and useful treatment. And a woman who's going through menopause, especially if she has symptoms like hot flashes, should talk to her provider about hormone replacement therapy.
That's great. Thank you for that. We had some questions around exercise. So moderate versus vigorous and how we might describe those two things differently. So if you just want to touch on that real quickly for folks.
Yeah, so if you go back and when you look at the slides later, you'll see that there's a recommendation for 2.5 hours of moderate exertion activity. There's lots of different activities that could qualify as moderate exertion. I like to think about it as following. If you're doing that activity and you can have a normal conversation like Vic and I are having right now, that's not moderate exertion. But if you're starting to feel that your sentences are a little bit shorter, you can't speak with long, complex sentences, your answers are a little bit briefer because you're trying to catch your breath, that's moderate exertion. So that could be walking. It certainly can be climbing stairs. In most cases, running is more than moderate. It's more of that vigorous. But, any activity, if you feel like you're, having trouble speaking in full sentences, that's probably moderate exertion, what you're doing at that time.
Great. That's helpful. We probably have time for one more question just because we're going to have to wrap things up here. And that really comes down to, I think, for folks, medications. So we had some questions around statins for cholesterol lowering. And so, they've gotten somewhat of a bad rap or have some, different stigma around them. So anything that you wanted to share with the group around statins in particular?
Yeah, so first off, just a bit about how we decide if someone needs to be on a statin. Certain people, for example, people who have had a heart attack or a stroke in the past, they should be on a statin. That is a great way to lower their risk of having another event. But even people without those events who have had no heart attack or stroke, but they have elevated cholesterol, they have elevated blood pressure, statins can significantly lower the risk of having cardiovascular events. Now, I think statins, if you Google statin and you read about statins, there's some of the most content about why statins are bad and you shouldn't take them. I think that statins are one of the most effective ways for people to lower their risk of having cardiovascular disease, heart attacks, and stroke. Those preventable events that we spoke about earlier, statins are one of the best way to lower that risk. And I think in the vast majority of cases, you can find a statin at a maybe there's a different, there's multiple different statins. Maybe you have to try a different one. Maybe you have to try a different dose. But typically, I can get patients on a statin. They're very happy. They have great long-term outcomes. Even if at the beginning I need to kind of talk to them and convince them that statins are good. That's what I truly believe. And I think, it's a shame that people who should be on statins aren't taking them because that's, preventable events are happening if, statins can really help prevent a lot of these heart attacks and strokes.
I think there's some key themes, and I apologize we didn't get to everyone's questions. We have some other great ones in there. I think the key theme here is if you've got questions around your own personal heart health journey, your own family history, symptoms, side effects, questions, find the care team that you feel most comfortable with. I wish Dr. Paz could see all of you and provide all of his key wisdom with you, but find a provider or care team that you trust and you can go and take these questions to, because there's some great ones in there and would love for you to make sure you get all of your needs met. But do really appreciate your time, Dr. Paz, today for all the great insights that you shared with us. And any last thoughts that you'd like to share?
Thank you, Vic, and thanks for everyone who joined and listened in. And I hope you found the information helpful.
Thanks, everyone. Have a great end of your morning, afternoon, your day. We really appreciate you spending the time with us. Thank you.
Bye, all.